Hello and welcome to this short training video regarding the PPE available to you during the COVID-19 outbreak. My name is Chris Bolton. I'm one of the Council's asbestos officers working for corporate health and safety, and I'm joined today by my colleague Andrew Griffin, also one of the asbestos officers. And during our daily roles in the Council, we utilise a variety of PPE, most of which is very similar to that that's being issued to you for COVID. So we're in an ideal position to show you how to properly don and doff, or put on and take off, these different types of PPE. Now, in terms of content, I'm going to give you a general overview of the types of PPE available to you, and then we'll run through the correct donning and doffing procedure for each individual piece of PPE. Now, just before we get started though, I do just want to make clear that PPE should be thought of as your last line of defence, and it's very important for you to remember that. Whilst it's highly effective, PPE alone will not make you invulnerable to the potential transmission of COVID-19. Welsh Government guidelines with relation to things like social distancing and hand hygiene should be followed at all times as the most effective control measure for reduction of spread of COVID-19. Think, can you undertake the task at hand from a safe distance with minimal contact? If so, always ensure that you do that first. So when we talk about the different types of PPE available, it's also important to remember that there is a correct donning and doffing procedure. Now, in terms of donning your PPE, you should first put on any gown or overall, then oversleeves if required, a respirator, face shields and eye protection, and finally gloves. Doffing isn't quite the reverse of that. We start with the gloves, then the oversleeves, then the gown or apron, then the face shield or eye protection, and finally your respirator. So to begin with, we'll look at aprons and oversleeves. Now, you may be given one of three different types. Okay, you could have a gown, you could have a tabard, or an apron. All of the styles offer a similar level of protection. However, with the aprons and tabards, additional sleeve covers are available because they do not cover your whole arm. Now, aprons, gowns and oversleeves are suitable for most light duties where close contact with a potentially COVID-infected person is required. All aprons and oversleeves are single use only and must be disposed of after use. So to begin with, we'll look at the button-up gowns. Now, when we run through all of these demonstrations, it's important to remember that you need to make sure your hands are thoroughly cleaned and sanitized before touching your PPE. Once you've thoroughly cleaned and sanitized your hands, as Andrew is doing now, you can pick up your PPE. And in the case of the gown, we need to pick it up and open it out and place our hands through the sleeves, pulling the apron over our shoulders. Now, these gowns fasten at the back. You may be able to do the top fasteners yourselves, but it's more practical to ask a buddy to fasten these for you, working from the top down to the bottom. Now, of course, this may mean that your buddy needs to break social distancing guidelines, and so it's important that they risk assess what PPE they may need to wear in order to do this. And remember to always ensure that the cuffs of your gown go over any gloves that you may be wearing. Once you finish your task, in order to doff the gown, reach behind you and pull the buttons apart. Again, if you need a buddy, then make sure that they are still wearing their PPE before they finish removing yours. Once it's unfastened, roll the gown downwards and inside out away from your body. Remember not to touch the outer surface of the gown as it may be contaminated. And once you've removed it, dispose of the gown immediately. These are not reusable. So the second form you may get is a tie-back apron, and this is very similar to the tabard in that both go over your heads. We're going to demonstrate using the tie-back apron for you, but the procedure for a tabard is almost exactly the same. It's just that you put your hands through the holes on the side as it goes over your head. So to begin with, having thoroughly sanitized our hands, we place the apron over our head. We then, in the case of the apron, get the wrist straps and tie them at the back of our body. The tabard doesn't have wrist straps, it will just sit on your shoulders. Now you'll see that Andrew's arms are uncovered, so you'll need sleeve covers or overarm protectors to go with these, and we'll show you how to don and doff those shortly. So once you finish your task and you wish to take this off, the first thing you need to do is grab around the neck and pull forward. This will allow your apron or tabard to fall gently forward. You can then reach behind you and break the tie at the waist. You can then fold your apron or tabard away from your body and in on itself, but please make sure you don't touch the outer surface as it may be contaminated. Once removed, dispose of the apron or tabard immediately, and once again, ensure your hands are thoroughly cleaned and sanitized. So, as I said, with these you may need some oversleeves. Now these will come packaged inside out. So the first thing you need to do, make sure your hands are sanitized and remove any watches or bracelets as they may break the oversleeve. You roll the oversleeve up and place your hand through up above the elbow. Now because it's inside out, you then need to grab it at the bottom and in one fluid motion pull it up your arm, rolling it so that the seam is now on the inside. If you hold your arm at a right angle, your elbow will help to catch the seam as you go. In order to remove this, once you finish your task, slide 2 fingers into the cuff of the oversleeve at the top, just like removing a glove. You then pull the oversleeve downwards and away from your wrist, rolling it inside out as you go. Once again, as with the aprons, tabards and gowns, you need to dispose of these immediately as they are not reusable. So just to close this section out, some quick do's and don'ts for oversleeves and aprons. Do make sure that you don aprons before oversleeves and doff them in reverse. Do remove all watches and bracelets before wearing oversleeves. And remember, do not touch the outer surface of aprons or oversleeves as they may be contaminated. Ensure that anyone assisting you in the donning or doffing of gowns wears their own PPE until the doffing procedure is complete. Something else that you may be issued is a coverall. Now coveralls come in a variety of sizes and colours, but any coverall you're issued should be a type 5-6 category 3. Some packets will have a little ticket inside them detailing this, or there may be a sticker on the coverall itself. The colour of the coverall doesn't matter, it has no effect on its protection. However, it is important that you select the right size coverall for you. This will avoid any tears or trip hazards while wearing it. And these coveralls are suitable for more heavy duty work where close contact with a potentially contaminated person is required. If you're going to wear a face mask or gloves as well, they should be worn beneath your coverall. And again, just like with aprons, coveralls are single use only. Okay, so in order to put your coveralls on, first roll them up and step through the legs. Once you've stepped through the legs, pull the coverall up and over your body, placing your arms through. Then zip up the front of the coverall and ensure that the sticky fastener is placed over the zip to seal it in place. If you're going to be wearing a face mask, it is important that you don it before pulling up the hood of your overall. Once that's done, you can pull up your hood and carry out your work. When you finish your task, in order to remove them, the first thing we need to do is obviously remove our hood. We then unzip our coveralls and remove our arms. We can then roll our coveralls down and away from our body, turning them inside out as we go, and step out of the legs at the bottom. Once removed, dispose of your coveralls immediately, and once again ensure your hands are thoroughly clean and sanitised. Probably the most common piece of PPE that any of you will be issued with is a face mask. Now, you may be issued one of two different kinds. You could have a surgical mask, which is general use and suitable for most working practices, or you could have an N95 face piece, which is better suited for close contact with persons known to be symptomatic, or where it's likely that a surgical mask may become easily torn or damaged during your working practice. Now, before donning either type of mask, of course, just like with everything else, we need to make sure that our hands are thoroughly clean and sanitised. So in order to don a surgical mask, we need to remember not to touch the surface of the mask itself. We hold it only using the straps and grasp the outer edges only to adjust our fit. Now, the white side of the mask goes towards the wearer and the pleats will face up. The blue side of the mask faces outwards and the pleats will face down. Now, you could also be issued with a headband. We're going to be using one here for the purposes of demonstration. If you're using a headband, first place one strap of the mask into the band. Otherwise, place this strap over your ear. Now, if you're using the headband, pass it around the back of your head and place the other strap into the opposite side of the band. If you're not using one, pull the mask across the front of your face and fasten it over your other ear. Once the mask is in position, take 2 fingers of each hand and press on the noseband firmly, pressing down and away from your face to secure the mask around the bridge of your nose. Once you're satisfied around the bridge of your nose, gently grasp the bottom edge of the mask and pull it down so that it fully covers your chin. Now, once you finish your duties and you want to remove the face mask, you begin by unhooking one strap from the band or removing one strap from your ear. Then, holding the strap, pull the mask gently away from your face, and remember, do not touch the surface of the mask as it may be contaminated. Now, the other type of mask you may be issued with is the N95. Again, we're going to use a headband here. If you don't have one, you will be attaching the mask directly to your ears. So to start with, place one strap into the headband and then pass it around the back of your head and place the other strap in. If you're not using the headband, place one strap on your ear and pull the mask across the front of your face. Now, gently pull the mask into position so that it sits low on the bridge of your nose and covers your chin. Once it's in place, just like with the surgical mask, take 2 fingers and press firmly on the noseband, pressing down and away from your face to secure it around the bridge of your nose. To check the fit of the mask, cup both of your hands over the surface of the mask and take a sharp breath in and out. If you feel any air escaping from the mask, then adjust the mask and repeat the process. To remove the N95 mask, we start by first unhooking one strap from the band at the back of your head, or removing a strap from your ear. Holding the strap, pull the mask gently away from your face, and remember, do not touch the surface. Unhook the other strap from your headband if you're using it, or otherwise remove the other strap from your ear. Now, this mask may be reused for the duration of your shift, providing it has not become sodden or soiled. If you are going to reuse it, place the mask immediately into a sealable bag for safekeeping. Do not let it hang loose around your neck or let it sit out in the open. When you finish with the mask at the end of your shift, dispose of it and the sealable bag that you've been keeping it in, and ensure that your hands are thoroughly clean and sanitized after touching it. So do's and don'ts for face masks. Do make sure, as with everything else, that your hands are clean and sanitized before donning and after doffing your mask. Do ensure that you perform that fit check if you're wearing an N95. It's very important to make sure that the mask sits on your face correctly. Do not touch the surface of a surgical mask, either in the donning or doffing procedure. Do not, under any circumstance, allow a mask to hang loose around your neck. Doing so may lead to the mask itself becoming contaminated. and do not use any mask for any more than one shift. Next, we look at face shields and eye protection. Now, you may be issued with one of two different kinds of face shields or one of many different brands or models of eye protection. All offer similar protection. And these are suited for close contact with persons known to be symptomatic and are designed to protect against the splashing or spattering of bodily fluids. Now, it's recommended that a suitable face mask is worn beneath the visor or alongside your eye protection, as they don't offer any respiratory protection. Now, both of these products are provided as non-sterile, so it's very important that you sanitize them before and after every use. So in order to don your eye protection, first hold the glasses by the arms and clean the surface using a cleaning wipe or solution. Once you've done so, allow the surfaces to dry and then place the glasses onto your head using the arms. And then in order to remove, we simply reverse the process. Remove the glasses using the arms, and keeping hold of them by the arms, clean the surfaces using a suitable cleaning wipe or solution. Do make sure you allow the glasses to dry before you place them back into a sealable bag or container for repeated use. And do make sure that you thoroughly sanitize your hands after handling them. The first kind of face shield that we look at is the ScreenTech Flexible Face Shield. Now, if you're using a new visor, it will come packaged with a protective film. Make sure you remove this first. Then clean the visor surface using a suitable cleaning wipe or solution and allow it to dry. Make sure you put on any other PPE before you attempt to don this face guard, as it will reduce your visibility and movement. So, in order to don it, we hold the visor by the straps and position the headband against our forehead. We then wrap the straps around to the rear of our head and pull the straps toward each other to determine the appropriate size for our fastener. Once we understand the correct size, we can remove the visor from our head and firmly insert the fastening tab into the correct sizing slot. With the visor suitably sized, we can simply place it back over our head and gently pull it down into position. Now, in order to remove the face guard, we simply hold it by the straps and gently lift it away from our head. If we're going to reuse the visor, then we now unfasten our tabs so that we can fold them flat for storage. And we clean the visor using a suitable cleaning wipe or solution and allow it to dry before placing it into a sealable bag or container for storage. However, please do remember that if a visor has become contaminated during use, then it must be disposed of rather than cleaned. So the next visor we look at is the solid TRM Medi visor. Now, just like with the flexible visor, we need to clean this with a cleaning wipe or solution before we use it, and we need to make sure that any other PPE is donned first. We hold the visor by the top tab and put it over our head, positioning the foam pad firmly against your forehead. Now, in order to remove, we simply grasp the top tab again and lift the visor away from our head. We can then clean it just like with the flexible visor using a cleaning wipe or solution and place it into a sealable bag. Once again, if it's contaminated, it must be disposed of. So in terms of do's and don'ts for face shields and visors, do make sure that hands, visors and glasses are sanitized before and after every use. And do ensure you don all other PPE before donning a visor or face shield. Do not reuse contaminated equipment. So finally, we'll look at gloves. Again, a very commonly issued piece of PPE. Now, these protective gloves are available in a variety of sizes, and it's important that you select the right size glove for your hand. Otherwise, the glove may break or slip during use. Now, all gloves are single use only, and they must be disposed of immediately after use. In order to don gloves, we first need to make sure that we remove any jewellery and ensure that our nails are suitably trimmed so that we don't break the glove. Then, making sure our hands have been suitably sanitised, we pick the gloves up and, holding a glove in one hand, we insert our opposite hand. Spread our fingers into the gloves and pull them down towards your wrist. With the first glove on, we can put the second one on in exactly the same manner, and then check the gloves for any holes or tears before starting your job. If you find any holes or tears, the gloves should be removed and replaced immediately. In order to remove gloves, we first pinch our first glove at the wrist and pull it away from our hand towards the tips of our fingers. We then keep hold of that glove in our remaining gloved hands. We then take 2 fingers of our naked hand and slide it into the gloved hand inside the cuff. We pull the glove away from the wrist, turning it inside out, and keeping the other glove inside. We can then dispose of both gloves appropriately and sanitize our hands. So in terms of do's and don'ts, do make sure that you're wearing the correct size glove for your hands. Do remove all jewellery and ensure that your nails are trimmed before wearing gloves. And remember, do not reuse gloves under any circumstance. Once removed, they must be disposed of immediately. That covers all of the PPE that you may be issued, so just a quick summary for you. Remember that PPE must be donned and doffed in the correct order and worn correctly. Hand hygiene is essential in avoiding contamination when donning and doffing all types of PPE. And remember that whilst it is highly effective, PPE should be thought of as your last line of defence. Safe working practices, including social distancing and good hand hygiene, should be strictly adhered to at all times, regardless of the PPE that's being worn. Thanks for your attention and stay safe.